Hello everyone, and welcome to this audio podcast. This audio podcast is part of this Traadax Fissure, this Traadax Rupture. This audio podcast about in around this intermission and this chartered edition evidence-based perspective in around and this audio podcast in around another where this audio podcast in another storm robotics production. In this audio podcast overview, there will be a basis in around a sort of an overview in around in around a sort of a guideline or a guideline or a sort of a frameworks in around improving the standard of care of children or young people in kidney disease through the pediatric nephrology networks. This was a sort of a works that had had this was works this was a works that sort of that had taken place in around 2011, where various specialists in around a specific in around a specific area of pediatric and young people care, where our colleagues and collaborators had been involved in developing a framework or a guide or a sort of a report in around a sort of a report aligned to NHS, aligned to a National Health Service, aligned to the National Health Service NHS, and in context of kidney care, and where this works, or this guideline, or this frameworks, or this networks networks sort of guideline or report was where colleagues and collaborators were between sort of NHS Kidney Care, the Royal College of Paediatrics and Child Health, and the British Association of Paediatric Nephrology, and this works in this overview. As part of this overview, here I thought here I would form a sort of here I thought it'd be a good sort of an opportunity to highlight some works in around sort of the executive summary in around this works and the full report is available through the British Association of Paediatric Nephrology as well, and so in this report, in this works, there have been some sort of there have been some perspectives in around some recommendations, and sort of a case for change in context of pediatrics and young people services, and a basis in around commissioning workforce planning, and also and also uh, uh, and also where the report had a basis in around the structures in around the delivery of care for pediatrics and young people in and around suffering with chronic kidney disease or kidney diseases. And so and so and so in around sort of the a basis in around the executive summary. So there are 13 centers or sites for pediatric nephrology in the United Kingdom, of which sort of retrospectively 10 provide renal transplantation services. The geographical area covered the population served and the number of hospitals or sites from which the tertiary center receives referrals varies, and thus the model of services is necessarily different for each region. The care for children or young people with renal diseases is not confined to the tertiary center, and many children or young people live long distances from tertiary center and having delivered by local services. Currently, provision of care is not always joined up or has not been always joined up across traditional organizational boundaries. Although robust evidence is scarce, this fragmentation can and has resulted in a lack of quality in both equity of and access to care. The focus of this report or this document, as the BAPN, the British Association of Paediatric Nephrology, sort of retrospectively in 2011 had prompted, was to explore how structured, formalized networks of care provision can provide a coordinated, high-quality pathway of care, providing as much treatment as possible close to those who suffer with chronic kidney disease, and specifically pediatrics and young people closer to home, whilst ensuring the best possible outcome for the child or of the child or children. The aim had been to provide guidance for those commissioning and providing and using pediatric nephrology networks, and this had been achieved by studying the current provision of care and researching examples of good practice both within pediatric nephrology and in other specialties, and drawing upon the expertise of the many organizations represented in the working group, including input from patient and carer representatives. The result is a set of principles and standards against which those commissioning, providing, and using the services evaluate own services. The work is closely aligned to a document referred to as bringing networks to life, bringing networks to life from and as published by the Royal College of Paediatrics and Child Health, and setting out the vision and strategy for high quality pediatric care within networks, and with which there are many principles in many principles that are common and synonymous. Standards have taken a broad range of national documents and are referenced. Healthcare is at the same time this report highlights and outlines that healthcare is forever being delivered in a changing political and social climate. And within this, it is important that there is a planned approach and continuing drive to raise the quality of care for each individual patient. In his review of children's services, retrospectively in 2010, Professor Sir Ian Kennedy wrote, in successful networks of care built around specialist children's hospitals, children will receive the best possible quality of care as close to where they live as possible. Without successful networks, children might receive inappropriate or poorer quality treatment locally, or else may be required to travel long distances, receiving treatment in specialist centers that could just as easily take place in local hospitals. Kidney disease in children is fortunately rare, but the consequences on individual families with children with kidney problems can be devastating. With appropriate coordinated networks of care, these families, wherever they live, can be supported to manage the conditions to achieve the best quality of life. This report, this report informs that the development by a working group of experts convened by the British Association of Paediatric Nephrology and the Royal College of Paediatrics and Child Health, which included representatives from patients and carers. The sort of contributors in this works are highlighted in within the report and within the document. Now, in around some of the additional context there is an outline there is an overview, in around the sort of and then sort of network provider standards in context of pediatric in context of the pediatric kidney care specialty, and a base and recommendations in around network commissioner standards in context of the pediatric kidney care specialty as well. And the document makes a specific case for change, and that is that the size of the regions, the population served, and the number of hospitals from which the tertiary center receives referrals varies, and thus the model of services is necessarily different from of each region. The care of children with renal disease is not confined to the tertiary center, and many children can live distances from tertiary center and to the tertiary and to the tertiary and have care delivered by local services. Currently, there is of currently currently or in sort of in recent in the time when this report and this document had been had been had been had been had been coordinated. There had been variances in service in there have been variances in the fragmentation of particular pediatric and young people's services and care, and a lack of expertise in and providing care, which compromises patient safety and provision of a high quality service. So a working group was convened to address how establishing pediatric nephrology networks could address these issues. This document, on this report, on this sort of framework, sort of provides a guidance for those commissioning and providing and using those existing networks in around pediatrics and young people's services. So this document or this report is available through the British Association of Paediatric Nephrology and available and also available through the Royal College of Paediatrics and Child Health in the United Kingdom. This document is a collaborative effort between several organisations, and again, where collaborators involved had been from clinicians and physicians and sort of service user collaborations. Service user collaborations have been involved in this works as well, and the works this report as well is provides again a sort of a summary in context of nephrology networks aligned to pediatrics and young people services. So this draws a sort of a close on this audio podcast as part of this Traadax Fissure. This has been an audio podcast as part of a Traadax Rupture, an audio podcast aligned to a Storm Robotics production, and an audio podcast as part of a Charlotte edition, an evidence-based perspective, and an audio podcast as part of an intermission as well. Once again, this report is available through the British Association of Paediatric Nephrology, and it is works that had a collaborative effort and involvement across organizations and from a sort of a bottom up approach as well. So thank you again for tuning in, and this audio podcast is in intermission is a part once again a part of a Storm Robotics production. Thank you.